Up next, super excited for this one. She mentioned AI a couple of times, and we're going to dive further into how you can use that and a couple of other tools to hack your practice with Dr. Vasanth Kainkaryam. He is a triple board certified and founded Four Elements DPC and Wellness space in Connecticut. Those 4 elements are engage, educate, empower, and encourage. And today, Dr. V is going to engage, educate, empower, and encourage all of us to leverage these workplace hacks to improve your workflows and enhance your practice operations. Give it up for Dr. V. Remember to stand.
Thank you. Thanks. Thank you much. Good afternoon, everyone. Am I on? Looks like I am. All right. Thank you all for joining me this afternoon. I'm super excited to talk about technology. So technology in healthcare and how we as clinicians can make it work for us as opposed to feeling bound by it. So that's kind of the big theme for today. You will learn about 3 Google Workspace features to enhance your practice operations. So how many of you here use some type of Google product in your practices? Great. So there's a lot Google can do that a lot of us just aren't aware of. Number 2, you'll learn about 3 considerations when using an AI scribe software. And lastly, I want to talk about an amazing tool that I discovered last year called Tabflows. And so a lot of what I'm going to talk about today, I will be using actual product names because I will be talking about my toolbox and how we're using it in our practice so that you can walk away with thinking about what you can do in your practices, but also to know what's out there and what technology can do for you. So let's talk about Google Workspace here. How many of you, raise of hands, do you think that you can use Google Workspace in healthcare and it be okay? Some people. Okay, great. But let's start talking about what can Google Workspace do for you. It has a lot. You can schedule appointments, you can record meetings and take notes, you can send marketing emails as opposed to using another third-party product like Constant Contact or MailChimp. You can sign documents and contracts that are appropriate and are legally binding. You can do video editing, and my favorite product is Notebook LM. How many of you have heard of Notebook LM? Some of you. So we'll talk about what that can do for you. But let's first answer the question, is Google HIPAA compliant? The answer is yes, it can be. When you subscribe to a Google Workspace product, in your account settings, there is an option at the very bottom that allows you to sign a BAA agreement with Google that allows it to be HIPAA compliant. Now, there are certain things you have to adjust in your settings afterwards, which they clearly lay out there, and you just have to follow the directions, but you can use it for healthcare. So that's a huge thing that a lot of people are like, I don't think I can use Google, but if you have the paid Google Workspace, the answer is you can. What are the things in there that you can use? Well, you've got Gmail, Google Calendar, Google Drive. So as we're talking about scanned patient documents and where you're going to store them so the rest of your team can use them, Google Drive can be HIPAA secure. Google Meet, and so on and so forth. So there's a ton of things within the existing workspace that can be used in healthcare when configured correctly. So let's talk about scheduling appointments, right? A lot of us are frustrated with scheduling, and I think during COVID, many of us used Calendly, for example, right? And it was great. You can say, oh, I want to, open up this time to this time. I want these slots only available for these particular appointment types. I feel like adding a few hours, so I'm going to throw in this day, or we're taking off this day. And so a lot of the current EMR functionality is not built to handle that degree of granularity, right? Where you can say, I want to make these slight tweaks. It's recurring and doesn't give you the freedom of choosing different appointment types in different slots. So that's one problem. The other thing is a lot of them are just very basic scheduling, right? So if you want patients to be able to self-schedule, they're not very nuanced. You can't always adjust some of those hours, but the big thing for a lot of us, especially if we have small practices, is we have our personal calendars, our kids' calendars, the sports calendar, the school calendar, and how do we now navigate something that takes into account all of those things? So let's talk about the tool, once again free with Google Workspace, where you can actually create an appointment booking link by specifying very specific dates, how far in advance you want people to be able to book, how much is the minimum time before they can book, if you want to create exceptions for particular dates. You're on vacation, you want to take this day off, so on and so forth. If you want to have buffer, you know what? I feel like this appointment, if I do this type, I need a little extra time afterwards. So to be able to have that buffer time, and how many types of appointments you want for that day, right? I only want to do 2 physicals a day or 2 intakes a day. All that amount of granularity can be there already built into Google Workspace. And if you look at the very right side, that's also looking at other calendars that you've shared with your accounts that it can cross-check. It can look at your family calendar, your personal calendar, your staffing calendar, and read all of that information before giving out availability for self-booking. So we use this a lot for our meet and greets. So it reads all my calendars and only offers what's available at the times that are available for individuals for booking. So an amazing tool. The one thing I will say that does not work, in full disclosure, is if it's an hour-long appointment, it has to start on the hour. It cannot start at 9:30 to 10:30. It has to be 9 to 10 or 10 to 11. So that is probably the one glitch. If they fix it, it would be very powerful. But that's the one thing that's kind of holding that up. Signing agreements. How many of you had to use things like an Adobe Sign or another tool, a DocuSign, to have documents signed? Raise your hands. How many of you have used some of those documents? Great. So Google, within Google Drive, will do all of that for you. So you don't need any additional third-party tools. You have an entire audit trail of all the signatures, the times. The documents go via email as well as into your Google Drive. And you can use this for a ton of things, whether it's vendor agreements, right, or subcontractors, or DPC agreements with patients, a ton of different things. So very simple. You go to the document, you share it, you request an e-signature, you tell where you want those signatures to happen, who you want to sign it, just like you would do in Adobe or DocuSign, and voila, the document gets signed, it sends a final one to you, throws it in the drive, and you have an entire audit trail of the document being signed. So another really fantastic free tool with it. Now, Notebook LM is probably one of my favorites. So with a lot of these AI tools that are available, the question with AI, right, is what is the data that it is reading to give you the information that you want it to give? With Notebook LM, you control the sources of data, and there's a ton of use cases for this. Things like referrals, right? So if you have fax numbers from different places, they're not publicly displayed on the web, but you have that data, you can have it read that data. Paper copies, right? So different reps and drug reps always give different, you might get handouts. All of that stuff, you can have it target. Policies and procedures for your team. How do we do this again? What's this workflow? You can point the AI to all of those. Anticipatory guidance, reference materials. So it goes on, and I'll share some examples with you today. So this one, for example, on the left side, you see some of the documents that I'm having it target, right? So it's the Bright Futures, the Harriet Lane notebook. I happen to have a PDF of Harriet Lane from back when I was in residency, so I uploaded that. Our well child check protocols, so on and so forth. And so I asked it to say, what is a normal blood pressure for an 8-year-old? And so it is querying all the data that I told it to and giving me percentiles, right? So quick references based on information that I have provided it. So a very great use case. The next one is showing the public view that does not show the sources. So for example, you can put this on an app, on your website, if you want your patients to use it, to say, hey, what shots will my child get at their 4-month well child check? And this, instead of querying the publicly available data, it is going to look at the data sources that I have pointed, saying in our practice, this is the way we do vaccines at these intervals. So for parents, they can use this as an educational tool to figure out what's going to happen. Pricing, right? So we're all about price transparency here in our DPC world, and so all of our price lists are public for our patients. They can just put in the chat, or even your team members, if they're wondering what the cost of a test is, throw it in there and saying, hey, what's the cost of this test again? And it'll give you that information. This is probably my favorite. Here's all of our information, and now we can't find it because it's in some paper copy scanned in some folder somewhere. This is a great place. So it will read text on the PDFs and pull that information for you. So we had a lot of these fax numbers for physical therapy, which is not public. It's not on any of those websites, and we need to be able to find it. So I basically asked for the fax number, and it's pulling it out. So for your team, when they're processing referrals, this is a great way of getting them information very quickly. So this is all easy to set up, and once again, with Google Workspace, it's free. This is another use case. Last one I'm going to share with Notebook LM is writing anticipatory guidance. So a lot of times, we want to, let's give them this handout, the Bright Futures handout, so on and so forth, is to be able to say, look, I've told you the information that I want to give to my patients. Now just write it for me in real time. So give me anticipatory guidance for a 2-month well child check as a letter addressed to the parent. And it goes on and tells you all the stuff that they need to do. And you literally copy, paste it into a letter to the patient, and you've given them all the information to prepare for their visits. The next tool I want to talk about is JotForm. How many of you have heard of JotForm? A fair number of you. So JotForm gained a lot of popularity during COVID. They were giving out free versions for healthcare providers. It is HIPAA compliant, and they've also come a long way from their initial product. There's a ton you can do on JotForm. A lot of it will overlap with Google Workspace, but they've got sort of a different view on certain things. So scheduling appointments, intake forms, that tends to be a big conversation among the DPC forums online is where are you going to get your intake forms, how are you going to do it? So JotForm, you can have patients fill out their intake form, and it will put it into your Google Drive. So once again, HIPAA compliant, and then you can upload it into the files. So great option for that one. You can take payments on it. You can have your own e-commerce store. So for those of you who have a little bit of retail in your practices, it's a great way of building that out. And you can design your own app for your practice. And I'll show you the app that we designed for ours. So for example, we have our skincare products. So we have our own skincare line. All of that is on JotForm. I'm not paying anything extra for it. It integrates with all existing payment structures. So you can do it that way. And on the middle and the right, you see an example of the app. So it's a very easy to do, visually drop the links, put everything in there, but as a way of engaging with your patients. So for example, if they click on text in their app, it gives you the next screen that says, what are you texting about? Because we have different phone numbers for different service lines. So with one click, once they click on what service line, it pops up their SMS view, already pre-populates that phone number in there, and they just have to write their message. So a ton of stuff that you can do with this. Pricing, we already talked about that. Our entire pricing list is fully transparent on the app. So they click on pricing. I wonder how much this costs. Or if they ask us, hey, doc, what's this going to cost me? Just go to the app, click on it, you'll get all the pricing. Medication discount codes, right? And so we spent time going through all the brand name meds we tend to prescribe. We took the links to all their pharmaceutical assistance programs, all their coupon codes, put it in one place. So for patients, if we ever prescribe something, it's like, you know what, go take a look, check out the links on our app, see if we can save you some money. Great way of engaging with patients. The really cool thing that they did last year is they allowed push notifications. So for your patients who download the app, with just a few clicks, you can send out push notifications. Hey folks, snowstorm today, we're gonna open the office 2 hours late. Great, push notification, send it out to all your patients. Or, hey, we've got our new newsletter out, check out some of the stuff that we put out there. So once again, a great way of continuing to engage with patients in your practice. We're gonna shift gears for a second and talk about AI and AI scribing. And so I've used about 8 to 10 different tools before I finally settled on 2, and I'll talk to you about why. One of them is Heidi. So Heidi is an amazing AI scribe tool for a lot of reasons. So number 1, customization. Do you want fast, best? I want a lot of detail. I want less details. I want narrative. I want bullet points. I want quotes, no quotes. All of that you can customize to how you want your note to look. Offline recording, fantastic, right? You happen to be driving somewhere or whatever. You have your phone. You're going for a walk. I just want to record it and then have it go into the database and transcribe it afterwards. So they recently did that, I think, this year, where you can record on your phone in their Heidi app, and then it'll push into the database once you're connected to the internet, and then it'll continue to transcribe. There's a balance between transcription and templates, and I'll show you that in the next window, EMR integrations, but also from a user standpoint, a desktop version, a mobile version, and a web version. So you have the freedom in how you want to use it. So templates. So I created this lab results template that I want it to put all of my reports in that particular structure. So I give it categories, and I also give it instructions on how I want it to use that piece of data. So I want this to be in patient-friendly language. If it wasn't done, say it wasn't done. If there's sections on the very bottom where I say, if I didn't do it, don't even include that section so it doesn't confuse the patients. So the ability to tell the AI how you want it to do, how you want it to create the note based on your personal preference, it is allowed to do that. And so if you look on the left is an example of what the AI created based on the instructions I had given it, as well as the notes. The other one I'm in love with is Elation's Note Assist. Now, I use Elation a lot, and the new version of their note, which allows customization of free text, dictation, and discrete clickable fields, is very powerful for a lot of reasons. So for any of you who are really into data and being able to run reports, historically, discrete data fields have always been easier to query data from than free text. With AI, some of that has changed. But if you can have concrete data fields for certain data points that you want to run reports for, it doesn't get better than that. With Elation's new AI tool, it allows us to take all of that stuff together. So, sometimes I feel like clicking. Sometimes I want to type because I'm in a typing mood. Sometimes I just want to talk to my patients and not even worry about the computer. So to be able to choose what modality I want to use when I'm with my patient at that time, to me is very important. So if you look at this, right, I said one sentence. It says, so it looks like, based on your medical history, your cancer screening is up to date for colorectal cancer screening and prostate cancer, but we'll order a lung cancer screening because it's due. Right, one sentence. The AI took what I said, adjusted the click boxes for the right ones without me having to do anything except having a conversation with the patient. And if I want to go back and run reports on all of that stuff, I can. So the freedom to document how you want to document is very important. The other thing that is also really neat is in your messages to patients, they've created an option where you can just tell the AI what to write, and it will write it for you. So in this case, I said, tell the patient we sent a referral to Dr. Shariari, one of my friends who's a dermatologist, and to let us know if they don't hear in a week. Great. So started off, hey, because in the back end, I have instructions saying, hey, we tend to communicate informally with our patients. Don't say hi, say hey. It did that. The way the signatures are. And all of that stuff, literally just one line, click, and the AI will compose a note for you. In this one, I gave an example saying, write a letter to the parent, letting them know that your analysis was normal, cholesterol was normal, no concerns, include lab results. So pulling the data from the lab, actually displaying it in the results letter, and adding the qualifiers that we have with it. So lastly, we're going to talk about a few additional tools. Now, how many of you here are clinical? Raise your hand. Of those with your hands up, keep them up, how many of you do not know about open evidence? All right, a few. If you do not, that is your homework today. You have to go sign up. It's free. If you have an NPI number, it's free. So we'll talk a few examples with open evidence on how we use it for clinical knowledge, prior authorization letters. We'll talk about looking at data within your own EMR. And then we're going to talk a little about agentic AI and how we use AI tools as agents. So open evidence is a free tool currently that queries journal articles like the New England Journal, JAMA, and pulls the latest evidence and gives it right in front of you. And it sources all the different articles it got the information from. So I use this, for example, for a patient of mine that had severe myositis. We're not able to figure out what the diagnosis is. And I said, look, here's a clinical scenario. What do you think my differential diagnosis should be? And then you can follow up and saying, well, what would you do next? What tests would you order next? And kind of have a conversation. Now, a lot of us, today actually an article came out in DPC News that I had written of, will something like this replace the idea of e-consults, right? So years ago, many of us would use the same scenario, type it in e-consult and send it over, and a specialist would review that information and get it back to us. Now, with tools like this, we can get that information in real time while it's looking at some of that primary literature. This one I thought was really cool. For any of you who prescribe medical weight loss medications, you know that Medicare does not cover it. And so part of the fun with this was saying, how can I create a medical formulary exemption letter, appeal letter for my patient to get them covered for Zepbound? So I put that in there. It wrote the whole letter. It cited all the studies for Zepbound, all the cardiovascular protection, everything, packaged it into one nice letter that I copy-pasted, sent to their appeals department, and within the next day, Zepbound was approved for a Medicare patient. So for prior authorizations where you're getting stuck, you don't have a lot of time, your team is helping you out with it, a great resource to be able to put information. Now, you might be thinking, for those of you who haven't used it or have, can I put PHI in there? The answer is yes. Open Evidence has now changed their workflow so you can sign a BAA with them, and now all of a sudden you can enter PHI in this and have it a lot more targeted. They've now added one more feature, which I think is really cool, where, and once again, if people have not tried any scribing, this is kind of probably one to play with. It's free, where Open Evidence will scribe for you with your visit in real time, and just as of, I think, last week, it will give you medical reference material in the visit while it's actually happening based on what you're saying. So, for example, this one, I had a conversation about a patient having sore throat, blah, blah, blah. It's doing its thing on the right, and then all of a sudden, it gives me, hey, this article said this. This is non-inferior to this. This is when you expect these symptoms to resolve. So it's pulling in from the medical literature at the time of your visit with the patient to help guide your clinical thought process. So this is brand new. I think it's, like I said, just about a week or so. But to be able to use it and to have it completely free for anyone with an NPI number is fantastic. Now, technically, if you have a group NPI, I do know that you can sign up with a group NPI and share that to your team. So do with it what you will, but you can technically do that. Last few things I want to talk about is, so we have all this data, right? And so if you work with employers, employers want data. For your own operations, you want data. How do we get that data? So Elation also has a really cool tool, which I'm about to sign up for on Monday, or actually today. Hopefully they should have sent me the contract, where we can query a lot of the data. Now, before you had to write SQL code. So for those of you who have some coding knowledge, you can actually, you'd be able to write your codes and look at the databases. But now, the AI will write the code for you. So for example, you can say, hey, who's missed their appointment this last year? It will look at your practice's patient data and give you that information. I want to find patients by this diagnosis. Or what are the top 5 most CPT billed in the last 3 months? So financial, clinical, and also, as we talked about, from your notes, right? When you have structured data fields in your notes to be able to pull that out and look and analyze your population, right? So a great tool for when you're looking at, now I'm not just looking at the person, but I need to step back and look at operations and the population of my patients. What can I do? The last thing I want to talk about for today is agentic use of AI, such as ChatGPT. So agentic AI basically means that you are giving the AI tool a persona, you're giving it some qualifiers. So in this case, I wanted my AI to be a former chief financial officer, really good with predictive marketing, good at SWOT analysis, managerial accounting, PESTEL analysis, and all this other stuff. And I wanted to analyze my population. This is one example. You can use this for social media. You can use this for business operations. And I had it do this. I said, map all my zip codes to see where my patients are from. Great. Now I want you to look at the gender distribution of my patients to see who are the types of patients who have come to me. Now, I think a little bit later today, someone's going to talk about personas, right? So there's the personas that you want to attract, but then you also have to see who are you attracting and how do you market to them. And so look at a little bit more reflective. And then I said, if I want to change my membership rates, what do you think the reaction of these people will be? So now it's going and querying financial data, demographic data, average income, and looking at all of that and giving me a response saying, hey, if you change this, this is the way your annual income is going to change. But based on what we know of the finances and the demographics, it won't make as much of an impact for patients. So to be able to give you that additional decision-making data that you don't have to go hunting for all these different things, very, very powerful. So this is the agentic way of using a tool, something as simple as ChatGPT. I want to give Sully a shout out. So Sully is another AI company that is really looking at building an agentic approach to a lot of functions in the office, whether it's an interpreter, consultant, a scribe, receptionist, pharmacist. So they're really, they haven't built it all yet, but I had a video call with them, I want to say like a month ago. And it's just a really cool tool that's out there to kind of be aware of because they're doing a lot of these things, but building it in one platform. Speaking of one platform, how many of you have heard of tab flows? Great. So tab flows, as I was just telling my friend Jeff, is like, it's like the Lord of the Rings, where there's all these rings, and you want the one ring that controls them all. Or, it's kind of like tab flows. So tab flows is a Chrome extension that solves the pain points of, great, I have all these pieces of software, multiple logins, multiple tabs. I feel like I'm scrambled because I'm clicking here, clicking there. How do I do that in one smooth user experience? And so with tab flows, you have all your pieces of software as tabs, and all you have to do is you click, and it shifts the window open, opens that other tab. So while I'm in Elation, I'm clicking on Spruce, it pulls that patient's tab over. I can shoot them a quick text message, close it out. If I want to say, oh, there's a billing issue, let me click on Hint. It'll pull that patient's Hint account. I want to send them a supplement, click on Full Scripts. So the ability to keep the patient at the core and shift your software around is a fantastic tool. So that's why I kind of joke and say it's the one ring that controls them all. So there's a lot of pieces of software, and I think each of us have to figure out how do we maximize each tech tool before we keep adding more. Because you can keep adding more and spending more money. So part of it's learning, like Google Workspace. There's a ton it can do. It's just learning what it can do. Understanding workflows in your own practice, looking at process maps or QA tools to say, where are my pain points for my team? But then also knowing your team's palette for technology, right? Each team is built differently. So to understand, all right, if we're going to use all these pieces, can my team handle it? The first few years are going to be hard. Your technology stack is going to look very different 2-3 years into it than it does when you first open. So kind of just understanding that's the natural part of growing and asking other docs who've done it and who've built systems and processes that work for them and try those out. The last thing I want to leave you with is this. AI and technology are tools, but need oversight. You need to know enough to control the technology and not have it control you. Thank you very much.